So imagine spending decades mastering, traditional medicine.
Right, going through all that grueling training.
Exactly. I mean, you become board certified in 4 different specialties, and you build this thriving, highly respected practice. You basically have all the answers.
Or at least society tells you that you have all the answers.
Yeah, exactly. But then your own mind and body completely collapse, and they do it in a way that literally none of your medical textbooks can fix. The systems you trusted just fail you.
Which is a pretty terrifying place to
Well,
be.
absolutely. So today we are doing a deep dive into a stack of sources that tell the story of someone who had to abandon modern medicine just to save her own life.
And spoiler alert, she somehow ends up building artificial intelligence platforms for wellness coaches.
Which is just a wild pivot. We are pulling all this from the coaching websites, the official biography, and the YouTube channel of Dr. Christine Sauer.
Right, and she is a retired German-trained physician and naturopath who is now based out of Canada.
Okay, let's unpack this, because our mission today is to explore a really profound paradox. We want to figure out how a board-certified medical doctor, someone totally rooted in flesh and blood human biology, pivots into holistic healing, and then ultimately becomes a champion for AI.
What's fascinating here is that we live in an era of just intense hyper-specialization. We tend to fragment the human experience entirely.
Yeah, like putting everything into tiny boxes.
Exactly. I mean, if you have a skin issue, you go see a dermatologist. If you have a mood disorder, you see a psychiatrist. Digestion problems, you go to a gastroenterologist.
It's all very compartmentalized.
It is. But what we are looking at in these sources is a blueprint for the exact opposite. It's really a masterclass in synthesis.
Right, pulling it all together.
Yeah, we are tracking this journey from extreme specialization to holistic integration. She blends traditional science, nature, deep psychological trauma, and eventually the computational power of artificial intelligence.
Well, to really understand that destination, especially the AI stuff, we have to look at the structural failure that forced this journey in the first place.
The collapse.
Yeah, the collapse. Let's look at her traditional beginnings. Dr. Christine Sauer grew up in Germany and achieved what most people would consider the absolute pinnacle of medical success.
She was really at the top of her game.
For sure. She worked in a family and naturopathic practice. She completed a second residency, and she became board certified in dermatology, naturopathy, allergology, and phlebology.
Phlebology being the study of leg vein diseases, right?
Yes, exactly. And she opened her own rapid growth practice. So from the outside looking in, she is at the absolute top of her field.
She had completely mastered the silos. But, the problem with silos is that they just don't communicate with each other when a massive systemic threat arrives.
They're too isolated.
Right. And the sources describe what she calls the abyss. It basically begins with severe back pain. Now, in a siloed system, that's just an orthopedist's problem, right?
It's just a structural issue.
Exactly. But chronic pain elevates cortisol, and that disrupts your sleep and your mood. And for her, it cascaded into severe depression and morbid obesity.
Oh, wow. So it just dominoes.
It totally dominoes.
Yeah.
The sources mention she nearly lost her life and her cognitive function to just deep despair and a really heavy reliance on psychiatric medications.
That is heavy. And on top of this massive physiological crash, she also experiences the tragic suicide of her ex-husband.
Right. So this isn't just, feeling a little burnt out.
No, not at all. This is a total multi-system failure. The nervous system, the endocrine system, her psychological state, they all basically crash simultaneously.
This is just devastating.
And then in 1997, she and her 2 sons moved to Halifax, Nova Scotia. She gives up her medical practice in Germany.
She walks away from all of it.
Yeah, she is completely stripped of her professional identity. Everything she had worked for is just gone.
Which forces this really profound realization. You can possess deep, technical expertise in dermatology or leg veins.
Yeah.
But when the mind, the gut, and the nervous system all collapse at once, those specialized tools are completely useless.
Because they're designed for one specific problem.
Exactly. She couldn't just treat the symptom of depression or the symptom of back pain. She had to address the underlying architecture of her health.
That makes a lot of sense.
She actually uses this phrase in her bio that I love, made in Germany, delivered from Canada.
Oh, I like that.
Yeah, it highlights both a literal relocation and a philosophical one. She was actively searching for a completely new paradigm.
Well, let's examine how she actually rebuilt that architecture. Because the list of qualifications she acquires after her collapse is just fascinating to me.
It's quite a list.
It is. And she doesn't reject science at all. She just pivots to entirely different branches of it.
Right. She goes in a totally different direction.
Yeah. According to the sources, she becomes a licensed brain trainer under Dr. Daniel Amen, a licensed neuroencoding specialist under Dr. Joseph McClendon III, an integrative nutrition health coach, a gastrointestinal disease specialist, and a certified havening techniques practitioner.
That is quite the resume pivot.
Yeah.
We should probably break down the mechanics of those certifications, though,
Yeah, let's do that.
because they represent this massive shift from just treating symptoms to actively optimizing systems. Take Dr. Daniel Amen's work, for instance.
Okay, the brain trainer part.
Right. His approach relies heavily on brain SPECT imaging to actually look at blood flow and activity patterns in the brain.
So it's very visual, very physical.
Exactly. It
Right.
treats psychiatry not just as a behavioral science where you just talk about your feelings, but as a physiological one. If your brain is physically inflamed, your mood is going to reflect that.
That makes total sense.
Or look at the havening techniques.
Yeah, I noticed that in the sources and I was curious. It's described as a psychosensory method. How exactly does a sensory method alter deep psychological trauma?
Well, it's essentially rooted in neuroscience. When a person experiences a highly traumatic event, the receptors in the amygdala, which is basically the brain's threat center, they essentially get stuck in this open, hypervigilant position.
So your brain thinks you're always in danger.
Right. Constantly. And havening uses specific types of soothing touch, usually on the arms, hands, or the face.
Just simple physical touch.
Yeah, but this specific physical touch generates delta waves in the brain. And delta waves are usually only present when you're in deep restorative sleep.
Oh, wow.
And those delta waves trigger a chemical cascade that literally unglues those trauma receptors in the amygdala. It actually depotentiates the traumatic memory.
So she is literally moving from prescribing a pill to using physical touch to actively alter brain chemistry. That is amazing.
It's a huge leap.
And she packages all of this into what she calls the Recover Your Sparkle system, which is based on 5 dimensions of health. And she focuses really heavily on the gut-brain connection to help people overcome anxiety, depression, and obesity.
And the gut-brain axis is really the ultimate example of synthesis.
How so?
Well, traditional medicine often treats digestion and mood as 2 completely separate issues. But the gut produces an estimated 90% of the body's serotonin.
Wait, really? 90%?
Yes. And the vagus nerve physically connects the enteric nervous system in your gut directly to your brain. It's a physical highway.
That is wild.
So if your gut microbiome is totally compromised by a poor diet or chronic stress, your brain is fundamentally starved of the neurotransmitters. It literally needs to feel joy or remain calm.
So you can't just talk therapy your way out of a bad diet.
Exactly.
Huh.
Her 5 dimensions, mental, physical, emotional, spiritual, and social and financial health, they are an acknowledgement that you just cannot isolate human biology.
Okay, but wait, I do need to push back on something I found in her coaching materials here.
Oh, what did you find?
Her website, Doc Christine Coaching Inc., mentions that she helps people safely withdraw, taper, or manage psychiatric medications. As a former physician but current health coach, managing psychiatric meds seems like a massive liability. Isn't it incredibly dangerous for a coach to handle medication tapering?
Oh, it is extremely dangerous if it's done incorrectly, which is exactly why her methodology here is so hyper-specific.
Okay, clarify that for me.
The sources state explicitly that she never makes medication decisions independently. She strictly collaborates with the client's prescribing physician.
Oh, okay. So she's not playing doctor.
No, not at all. If we connect this to the bigger picture,
Mm.
she isn't rejecting modern medicine. What she is providing is the daily mechanical protocol for an evidence-based taper.
So what does an evidence-based taper actually look like in practice then?
Well, historically, a lot of psychiatric tapering was just done way too quickly. Having a dose, then having it again a week later.
Which sounds awful.
It is. It can trigger severe withdrawal syndromes because the brain's receptors just haven't had time to adapt to the chemical drop.
Hmm.
Modern evidence-based protocols often use something called hyperbolic tapering.
Hyperbolic tapering, what does that mean?
This means you reduce the drug by a very small percentage, like maybe 10% of the current dose, not the original starting dose. So the reductions get smaller and smaller as the dose gets lower.
Okay, that makes sense. But why does a patient need a coach for that?
Because a prescribing doctor might agree to this slow plan, but they just do not have the bandwidth to monitor a patient's daily sleep, their nutrition, and their emotional stability during a taper that might take months.
Oh, right. That makes perfect sense. The clinical psychiatrist maybe has, what, 15 minutes every 3 months to write the script?
Exactly.
They don't have the time to track if the patient is actually eating enough protein to synthesize neurotransmitters during the withdrawal.
Not at all. So she is basically acting as the bridge between the clinical prescription and the daily lived reality of the patient.
She fills that structural gap left by the hyper-specialization of modern medicine we talked about earlier.
Yes. It's a completely holistic support system that ensures the foundation is stable while the chemical scaffolding is slowly being removed.
And, you can really see how this applies way beyond just clinical depression.
Oh, totally.
Like if you're listening to this and you're dealing with chronic burnout in your career, the lesson is exactly the same. You can't just take a weekend off, which is really just treating the symptom, and expect the burnout to vanish if your sleep, your nutrition, and your daily stress management are still fundamentally broken.
You need a multidimensional approach to your own resilience, for sure.
So once she stabilized her own multidimensional health, fixing herself wasn't enough. The systemic problem was just too large.
Right. The next logical phase of her career was scaling this hard-won knowledge.
And she certainly scaled it. She authored quite a few books. Let's see, the sources mention The F-Word Diet, How to Lose Fat, Get Fit, and Feel Fabulous Forever, and another one called Eating for Vibrant Health.
She also has a journal she gives away for free, right?
Yeah, it's called My Daily Sparkle of Gratitude. And she launched the Sparkles for Mental Health podcast to highlight stories of people who survived the abyss and are basically paying it forward.
She was really putting the information out there.
But the piece of source material that really struck me the most was her 2022 TEDx Dalhousie talk. It was titled, How to Help Depression Naturally. And in it, she proposes creating these barefoot doctors of the West.
That is a fascinating concept.
So what does this all mean? Let's look at the mechanics of that. Where does that term come from?
So the term barefoot doctors actually originates from mid-20th century China.
Really? Okay.
Yeah. The country faced this massive shortage of trained medical professionals, especially in their rural areas.
So what did they do?
Well, the solution was to take everyday agricultural workers, give them a few months of intensive training in basic preventive medicine, hygiene, and triage, and then just send them right back into their own communities.
Wow. Just everyday people.
Exactly. I mean, they weren't performing complex surgeries or anything, but they were stopping preventable diseases from killing people.
Oh, wow. So she is taking that historical model and adapting it to our modern mental health crisis.
Precisely. Because we have a massive bottleneck in clinical care right now.
Oh, for sure. People are waiting, 6 to 8 months just to see a psychiatrist or a therapist sometimes?
It's a huge problem. So by writing books, creating accessible courses, and doing these speaking engagements, she is essentially trying to train lay people to be mental health first responders.
She is completely decentralizing the knowledge.
Yes, a modern barefoot doctor, in her model, is just someone equipped to recognize the early signs of a nervous system crash in their friends or family.
Like spotting the smoke before the fire?
Exactly. They know how to listen with real empathy, they understand the basics of gut-brain nutrition, and crucially, they know when a situation requires escalation to a real clinical professional.
So it's basically preventative care, but at the community level.
That's exactly it.
But I do have to ask, can lay people actually handle the weight of severe mental health crises in their communities? We're talking about heavy stuff like depression, severe anxiety, and trauma.
Well, they aren't meant to replace the psychiatric ICU, right? They're meant to be the first aid kit.
Okay, the first aid kit.
Think about physical trauma. You don't need a medical degree to apply a tourniquet or perform CPR while you're waiting for the ambulance to show up.
Oh, that's a great point.
She is arguing that we need the mental health equivalent of CPR training.
That makes total sense.
If people in the community know how to help each other regulate their nervous systems through basic nutrition, sleep hygiene, and those psychosensory techniques like havening we talked about.
We can treat the daily emotional bleeds before they require actual hospitalization.
Exactly.
It's just a profound shift in perspective. I mean, you look at her arc. Starting in the rigid, siloed structure of a German medical practice, falling into the abyss, and then emerging as this holistic, decentralized educator, pushing for community-based naturopathy and gratitude.
It's an incredible journey.
It is. The narrative feels so complete. It's this inspiring return to nature, and then the source material throws a massive curveball.
Ah, yes. The technology pivot.
Yes. Here's where it gets really interesting. The sources reveal she founded something called the AI Wellness Universe.
Which just sounds so futuristic.
Right. And it is a not-for-profit platform offering no-tech artificial intelligence apps that are designed specifically for wellness entrepreneurs.
And they have some pretty interesting tools on there.
They really do. It features tools like the AI Affirmation Wizard, an AI Video Creator Star, an AI Gratitude Coach, and all these AI diet planners.
It really seems contradictory at first glance, doesn't it?
Totally. We usually position holistic natural healing and artificial intelligence as complete opposing forces.
Right, like oil and water.
It honestly feels like bringing a robot to a meditation retreat. I mean, if her entire Sparkle system is built on deep human empathy, physical touch, and the gut-brain connection, how does a generative AI tool fit into that? Doesn't an AI gratitude coach entirely defeat the purpose of real human connection?
This raises an important question about how we actually view technology. To understand the synthesis here, we really have to look at the specific demographic she built this platform for.
Okay, who is it for?
The AI Wellness Universe is explicitly tailored for recently retired professional women over 40 who are entering the wellness coaching sector.
Interesting. Why that specific group?
Because women entering this field later in life often possess an absolute abundance of the one thing AI just cannot replicate: lived experience and genuine human empathy.
That makes a lot of sense. They've lived a full life.
Exactly. They have survived their own challenges. They really know how to listen to people. But what they usually lack is the technical stack required to run a modern digital business.
Right. They aren't, prompt engineers.
Precisely. If you want to be a wellness coach today, you spend an exorbitant amount of time fighting administrative friction.
Oh, the business side of things.
Yeah. You have to write marketing copy, generate social media videos, design complex meal plans, manage client intake forms.
It's exhausting just hearing about it.
Right. And this demographic wants to heal people, but they end up spending 80% of their day wrestling with software.
Okay, so let's look at the mechanics of her no-tech AI. What does that actually mean for them?
It means she is building back-end wrappers. The user doesn't have to understand how to write a complex, multi-layered prompt for a large language model.
They don't have to learn code.
Exactly. The interface is totally simple. The coach inputs basic parameters about their client's dietary needs, and the AI instantly generates a customized Mediterranean diet plan.
Wow, just like that.
Yep. The coach clicks a button, and the AI generates a whole month's worth of positive affirmation content for their marketing channels.
It's like a surgeon. You wouldn't want a highly skilled heart surgeon spending 3 hours a day sterilizing their own scalpels, mopping the operating room floor, and managing the billing department.
No, of course not.
You want them doing the surgery. The AI is doing the sterilizing and the mopping here.
That is the perfect mechanical analogy. She isn't using AI to replace the human coach at all. She's using AI to remove the digital bottleneck, which allows the human coach to focus entirely on human empathy.
That's brilliant.
The AI itself basically becomes an administrative barefoot doctor for these women, taking care of the business infrastructure so they can actually take care of the people.
That is just an incredible reframing of technology. It's not silicon versus soul, It's using silicon to protect the bandwidth of the soul.
I love that way of putting it.
When you step back and really look at the totality of the sources we've reviewed today, the arc is just staggering. We started with a highly credentialed medical doctor managing leg veins and allergies in conventional, isolated silos.
And then we watched those silos collapse.
Right, plunging her into the physical and mental abyss. We tracked her as she synthesized neuroscience, ancient naturopathy, and psychosensory techniques just to rebuild her own biology.
A complete rebuild from the ground up.
And finally, we see her leveraging cutting-edge artificial intelligence to empower an entire generation of decentralized wellness coaches.
She really refused to be trapped by the failure of her original blueprint. I mean, think about it. When biology failed her, she looked to psychology.
Yeah.
When individual psychology wasn't scalable, she looked to sociology with the barefoot doctor's concept.
Right.
And when digital administration became a barrier for her community, she looked to computer science.
Which brings this entirely back to you listening to us right now. We so often fall into the trap of thinking that being well-informed or being an expert means doubling down on one tiny, hyper-specialized lane.
We box ourselves in.
We really do.
Yeah.
But the real breakthroughs, the actual solutions to the most complex problems in your career, your health, or your life, they usually don't come from digging your current silo deeper. They come from synthesis.
Absolutely.
They come from being willing to look at the mechanics of completely different fields and figuring out how they actually connect.
It requires a fundamental flexibility. We've examined how someone survived a total systemic collapse by fusing traditional medicine, holistic nutrition, and modern artificial intelligence.
It's a lot to process.
It is, but it forces us to ask a critical question about our own frameworks. If the systems that you rely on were to suddenly collapse tomorrow, what rigid artificial boundaries in your own education or your industry might be holding you back from synthesizing your next big breakthrough?
Sometimes the most important skill isn't reading the old blueprint perfectly. It's knowing when it's time to draft an entirely new set of plans.